Hi, my name is Makennah.
And my name is Kyle, and we are CYC practitioners.
Thanks for coming out today. We're so excited to talk to you about why a child and youth care practitioner should work with you.
You may be asking yourself, what is a child and youth care practitioner?
In Carol Stewart's textbook, Foundations of Child and Youth Care, she defines what we do as a profession which focuses on the developmental needs of children and families within the space and time of their daily lives.
We can play a variety of roles, such as an educator, a caretaker, a counselor, an advocator, and countless other roles.
In other words, anywhere where you can find youth, you can find us.
After researching your program, we learned that you work with street-involved people in Vancouver.
We understand that you give them clean injection and smoking materials, condoms, and provide them with STI and blood tests, as well as other medical assistance that they may need.
As a CYC, we can help in many possible ways, but these are just a few points to add. Firstly, we are non-judgmental care workers. We respect all of our clients' wishes and needs.
Secondly, as a child and youth care worker, we understand how a 2-minute interaction can make or break a relationship with the client. For example, it's important to know how to talk to them before and after the drug, as this will have a severe change in their attitude towards us as CYCs.
Thirdly, as a CYC, we are resourceful in connecting others with services that are offered within the city. This will assist the client in connecting to positive resources such as an injection site, shelters, food banks, and needle exchanges, and other medical assistance all around Vancouver.
As CYCs, we're really good at meeting clients where they're at. We understand and are able to empathize and be non-judgmental towards the youth that we work with.
Also, we are capable of providing emotional support to the youth that we work with. For example, we are able to listen and let youth drain their emotions in time of distress. We are someone that they can trust and confide in.
Lastly, we're able to provide motivational interviewing towards the youth that we work with. Using our active listening skills and emotional first aid, we provide a better therapeutic relationship for the youth in motivational interviewing.
CYCs complement street nurses by using daily life skills that are taught to our youth. For example, we are able to assist the youth we work with by cooking, budgeting, and cleaning, and other daily life tasks.
Secondly, CYCs also provide counseling to the youth that we work with. This will assist the CYC in gathering information and bringing it forward to the nurses that we work with on a daily basis if it's important.
We also, as CYCs, we provide harm reduction. For example, we are able to teach our youth different coping mechanisms to assist in times when a youth is in time of crisis and needs assistance in getting back to baseline. As a CYC, we are aware of a variety of coping mechanisms. For example, using mindfulness, this helps the youth in processing to take a step back and think for a minute or two. This helps the youth think positively for a minute before jumping ahead.
Also, we're able to provide non-judgment towards the youth we work with. As a CYC, it's important to understand what the client is saying in a non-judgmental way. This will help the youth in feeling more comfortable during conversations.
Also, as a CYC, we can help in terms of finding resources. We can assist the street nurses in attempting to gather resources. This also helps when CYCs come together with these nurses in planning proper resources in the community for youth.
Lastly, as a CYC, we're able to attend appointments with the clients to assist in needs. For example, if a CYC were to bring a child to the doctor's appointment, the CYC can gather information from the doctor with consent of the youth and provide information to the street nurses to assist the youth in cases where a nurse may need to know more information.
As CYCs, we have a different educational background. We learn things that a nurse may not have learned, so we are able to provide different perspectives and bring different skills to the field. We receive education on counseling skills, motivational interviewing, and accepting where each client is in their journey. We learn about how to individualize each client's needs and supports.
A big thing that we emphasize is meeting clients where they're at while being empathetic and non-judgmental. Hanging in is another skill that we practice. This means that we don't give up on clients when things get tough. This is relevant to the work that you do because as street nurses, you come across many people in different stages of their addiction.
A child and youth care worker could also be useful for motivational interviewing. Motivational interviewing is defined by Miller and Rolnick as a directive, client-centered counseling style for eliciting behavior change by helping clients to explore and resolve ambivalence.
Some of the skills of a motivational interview that would be essential while working with street-involved youth would be coming alongside, asking evocative questions, and learning about their goals and values.
Coming alongside is when you meet the client where they are and agreeing with their logic and how they see things. This helps the youth gain trust in us and be able to learn they can rely on us.
Asking evocative questions will help us get a deeper understanding of the client as well as their usage. We'll be able to learn how safe they are being and get a deeper understanding of who they are as a person.
Lastly, looking at the client's goals and values will help us individualize the care they will receive.
As we mentioned, CYCs are extremely non-judgmental. We are excellent at putting our egos and pride to the side in order to assist our clients to the best of our ability.
CYCs are passionate while helping the most vulnerable youth. We understand that not everyone is dealt with the same cards and that everyone faces their own individual difficulties.
We're able to help our clients by connecting them with resources that they may not have already been aware of.
We will be able to assist in helping youth to connect thoughts and feelings to their behaviors and understanding how their possible past trauma is affecting their everyday lives.
In conclusion, we believe that we'd be a great fit to work alongside the street nurses of Vancouver, as we are resourceful, resilient, dedicated, and skilled.
We really hope that you can see how beneficial it would be for us to work together.
Thank you so much for coming out and listening to our presentation.
We hope that you will consider us to come to work alongside you street nurses.